Healthy behaviors, such as limiting alcohol use and maintaining an active lifestyle, are the first step in preventing breast cancer. If you're worried that you might have breast cancer, you may be asking if there are any precautions you can do to lessen your risk. Certain risk factors, including family history, are unavoidable. You can reduce your risk by altering your lifestyle, though. In this video, we talk about how women are taking control of breast cancer prevention. Welcome to our YouTube channel, Health Discovery. Before we get started with the video, don't forget to smash the like button, share the video, and subscribe to the channel. Now let's get started. Number 12. Stay away from secondhand smoke. Despite the fact that smoking has not been linked to an increased risk of breast cancer, studies have revealed that animals exposed to high levels of secondhand smoke develop the disease. A 2005 report from the California Environmental Protection Agency also came to the same conclusion, concluding that secondhand smoking causes breast cancer in younger women, particularly premenopausal women. Getting rid of the habit will help you lower your chances of breast cancer and improve your general health because smoking and secondhand smoke are linked to various types of cancer and medical disorders. Number 11. Ask about genetic testing and know your family history. Even though this is a contentious procedure that only a few women's health insurance plans cover, it's something to think about if you meet the requirements. The BRCA1 and BRCA2 genes are the two most frequently discussed gene mutations. However, there is also a much more uncommon group of gene mutations, such as ATM and TP53, that can result in breast cancer. Number 10. Breastfeed your baby. According to research, women who breastfeed their children may experience a modest reduction in their risk of breast cancer, particularly if they do so for up to 2 years. Even though it's uncommon to breastfeed for this long in the United States, it is advised to do so for at least a few months. Breastfeeding, according to experts, lowers a woman's risk of breast cancer because it lessens the number of menstrual cycles she has overall, exposing her to lower hormone levels linked to the disease. Number 9. Clinical and self-breast exams. In addition to performing self-examinations of the breasts every month, experts advise women to visit their doctors for clinical breast exams every 3 years if they are under 40 and every year if they are 40 or older. When women perform breast self-exams, they may overlook changes that healthcare professionals can spot. They can also give women advice on preventing breast cancer while taking into consideration lifestyle choices and family history. In order to stop breast cancer from spreading and getting harder to treat successfully, early detection is essential. If you are one of the many women who have dense breast tissue, you should also inquire with your physician about undergoing an ultrasound, which your physician can see in your mammogram results. Ask if they won't tell you. Dense breast tissue makes it more difficult for your mammography to identify breast abnormalities, which could result in false positives. Even though your doctor assures you that everything is fine, it's crucial to keep pushing them. Number 8. Avoid environmental carcinogens. Researchers are working diligently to determine how environmental toxins and breast cancer are related. Environmental chemicals that have been shown in laboratory experiments to have estrogen-like qualities are of particular relevance since they theoretically could raise the risk of breast cancer. Examples of compounds that appear to have estrogen-like effects include those present in some plastics, specific cosmetics and personal care items, pesticides such as DDE, and polychlorinated biphenyls, PCBs. Although a direct connection between environmental chemicals and breast cancer has not yet been established, doctors advise staying away from questionable substances to be safe. Number 7. Ask about genetic testing and know your family history. Even though it's a contentious procedure that only some women with health insurance are eligible for, it's something to think about if you do. BRCA1 and BRCA2 gene mutations are the ones that are discussed the most frequently. However, a considerably smaller number of gene alterations, such as TP53 and ATM, can also cause breast cancer. Number 6. The link between birth control pills and breast cancer. There is some evidence that hormonal contraception, such as hormone-releasing IUDs and birth control pills, raises the risk of breast cancer. However, the risk is regarded as being extremely low, and it goes down once you stop using hormonal contraceptives. One more breast cancer could be anticipated for every 7,690 women who use hormonal contraception for at least a year, according to a recent study that found a link between using hormonal contraceptives and breast cancer. With your doctor, go over your contraception options. Aside from preventing unwanted pregnancies and managing menstrual bleeding, hormonal contraception also lowers the risk of developing other cancers, like ovarian and endometrial cancer. Number 5. Regular exercise for breast cancer prevention. Along with being crucial for overall health, regular exercise helps lower the risk of developing breast cancer. A study from the Women's Health Initiative found that even only 1.25 to 2.5 hours of brisk walking each week can cut a woman's risk of breast cancer by 18%, and that 10 hours of walking each week can further lower the risk. In order to vary your workouts and maintain motivation, you can also run, bike, swim, hike, and play sports. On at least 5 days each week, try to get in 45 to 60 minutes of exercise or moderate physical activity. Consistently engage in 30 minutes of physical activity each day at the very least. Number 4. Limit your alcohol use. The chance of acquiring breast cancer, as well as other types of cancer, is unmistakably connected to alcohol usage, and the risk rises with the amount of alcohol ingested. Women who have 1 drink of alcohol per day have a very slight increase in their risk of developing breast cancer compared to non-drinkers, whereas those who have 2 to 5 drinks per day have a risk that is almost 1.5 times greater. 1 drink per day is the maximum you should consume if you choose to drink. Number 3. Check your diet. In particular, for women after menopause, when the majority of a woman's estrogen comes from adipose tissue because the ovaries stop releasing estrogen, the American Cancer Society considers being overweight or obese as a risk factor for breast cancer. Higher amounts of estrogen may also increase the chance of developing breast cancer. According to research, women who put on weight as adults had a larger risk of developing breast cancer than those who have been obese since infancy. Talk to your doctor or a qualified dietitian about dietary adjustments that can help you lose weight and get to a healthy body weight if you are overweight. Number 2. Don't take postmenopausal hormone therapy. Research associating HRT with increased risks for breast cancer, heart disease, stroke, blood clots, and urine incontinence among women using HRT that contain both estrogen and progestin prompted researchers to examine the incidence rates of breast cancer and the prescription rates for HRT. If you are menopausal or on the verge of menopause and are having trouble coping with the symptoms of menopausal hormone changes, talk to your doctor about alternatives to HRT. Number 1. Get a mammogram. Breast self-examinations are a useful approach for you to get to know your breasts and how they feel so you can be alert to any changes that could be signs of breast cancer. The gold standard for finding breast cancer is a mammogram, which is advised for women starting at age 40 or earlier if a doctor wants to rule out breast cancer because of abnormalities in the breast. Breast cancer cannot be prevented, but mammography can detect it in its earliest stages and stop it from spreading and developing into a life-threatening condition. Breast cancer begins in the cells and develops gradually. Early signs of breast or nipple cancer may include a new lump in the breast or underarm, itching or discharge from the nipples, and changes in the texture of the skin in the breast or nipple. That concludes today's video. We hope you enjoyed it. Please share your thoughts in the comments section and let us know what topics you'd like to see in future videos. Thank you for watching.